Today we'll be talking with Erin Lord Kunz, and she's coming to us from the Rural Health Information Hub website. And I have our goals and objectives listed on the screen for today. Erin is actually from the Rural Health Information Hub. She joined in January of 2022, and she provides assistance through the resources and referral services through that website, and she helps maintain the content. So the content you see on there, you can thank her for that as well.
So today I'm going to do a walkthrough of the Rural Health Information Hub site. When I do this, I like to have an anchoring question, a scenario where a local health department just did a community health needs assessment. And so one of the topics that they want to focus in on is maternal health. So now they're at the starting point of this goal of really focusing in on maternal health from a public health perspective in their local health department. So how could Rural Health Information Hub help you with that? And what kind of information, resources, tools, data could you find on our site? So to begin, I will say that we are federally funded. So we're funded by the Federal Office of Rural Health Policy as a technical assistance center to help the state offices of rural health, but also just rural stakeholders in general with their rural health information needs. And I'll talk about it a little bit at the end, but you can contact us and get live alerts and data from us as you need. And so we aren't just the site that you're going to see, you can connect with a live human at any point that you need to. Okay, so let's go back to this anchoring question. How can public health agencies reduce maternal health disparities in rural areas of Minnesota? So I'm going to go through the main sections of our online library: topics and states, rural data visualizations, case studies and conversations, and also tools for success. For today, I want to focus on maternal health in different ways that we can use this topic guide to inform your question. So you will see on the top the overview, the FAQs, and then within the topic guide, you will also find resources, organizations, funding and opportunity, news, events, models, and innovations. In this case, we have an extra tab for the Rural Maternity Innovation Summit and some information about that. That is not on every guide. And then the About This Guide section, which lists the people who have helped inform this guide. So not just myself, but the external content expert reviewers that we use to inform the guide. I will try not to scroll too fast because I don't want to get anyone motion sick. But if you look through this, you will see that with the FAQs, we've included almost like a thesis on maternal health in rural areas where we try to focus on some of the most important topics, some of the most important statistics, and all of the resources that we use are hyperlinked. So that can be really handy. So as you're reading the narrative, if there's something that catches your eye or you want to know more information about, we, for the most part, use only open record resources, so things that you can go to right away. So for example, this paragraph talks about appropriate infant care, and according to the 2025 article, local availability of neonatal intensive care at rural hospitals, I can open this and it will take me to that, directly to that article. And so you'll see different resources in order from when they were published, and you can again get direct access to them by clicking on this. So in this way, we're kind of like a library where we have identified, selected, synthesized, and presented the information for you to find. And I will point out, now that it's 2026, it might be useful to know that this is all done by a human. So this is a first stop if you're looking at, I need resources on rural maternal health, our online library, and clicking on those resources within the topic guide is the most useful thing to do to begin with. Funding and opportunities related to that topic. So you'll see right now we only have one that is currently available, but we also, and when I say we, things that we have indexed, so we are not the funders, but things that we track and index for our users. And then there's one that did expire, but we often keep them on the site if they have a cyclical calendar grant year, because then you can still click on this, get information about it, and maybe be ready for the next year when that grant comes around again. And then our news is the last 60 days. So anything about rural health. I find this really helpful to our information specialists go through a lot of news sites to identify news items that are quality and talking about these specific topics. And I'm going to narrow by geography. Now, when I do this, you can see that I can select for states and see what there is about rural maternal health in Minnesota specifically. So we have this AHA, American Hospital Association organization, resources on improving maternity care for Indigenous populations in Minnesota. Now, there's another way to find information on Minnesota. If I narrow by geography, and that's going state by state. And this can be really useful because state by state, if that term is selected in the taxonomy, it means that the resource has information about all the states. So this can be really helpful for comparison purposes. So for example, this is the University of Minnesota Rural Health Research Center resource, but that's quite helpful because it talks about the availability of hospital-based obstetric services in the United States by county, a state-by-state report. Okay, so I'm gonna head over now to the rural data visualizations, which is one of my favorite parts of the site because it's really helpful for folks when they're trying to make a case for something for their stakeholders, for legislatures, for example. It offers data in a really easy way to, it's really easy to see and a helpful layout for folks. So when you first get to the Data Explorer, you'll see that it's defaulted to levels of poverty, that's the indicator selected, and at a national level. And right now it's showing all, but if you see, if I scroll my cursor over, it's going to show the poverty levels in different states, in metro and non-metro areas. And you can quickly see, even just as I do this, the places where rural struggles, right? So if I want to focus on just non-metro, you will see the percentage of those in poverty across the United States. Now let's change this to just Minnesota, because if I do that, you're going to get county level data. And I'm going to select all again so you can see all. But you can see pretty quickly just with shading the highest areas of concentrated poverty in Minnesota, as well as the lowest. I'm going to go to our chart gallery. And let's click by state in this case, rather than topic. And we'll go to Minnesota just to give you an example of some of the charts that you can see. And again, this would be under the state guide as well. So for example, 18 to 24-year-olds without a high school diploma in Minnesota. The darker shades mean more folks without high school diplomas. The lighter shades mean fewer folks. And then if you scroll over, it'll give you percentages. I'm going to go to Rural Health Models and Innovations because this is often a useful section for everyone, but also specifically if you're working from the perspective of public health. So when you're trying to do a new project, when you're trying to implement something new and see if it's going to work, you often need to know, how am I going to fund it? How am I going to implement it? How will I evaluate it? Will it be useful? Has anyone done something like this before, a different type of project? And so you'll see some recently added ones. But then you'll also see that you can search projects by evidence level, the source it comes from. So whether it was funded by HRSA or FORP, for example, what state, what topic. So this is the UAM's risk pregnancy program. So here you have our short description. What was the need? Arkansas had high rates of low birth weight babies, and pregnant patients in rural areas had difficulty accessing specialty obstetric care. What was the intervention? And then what were the results? Okay, so the second tool I'd like to show you is the Am I Rural tool. This can be really helpful. It can be fun to use as well to see what works. I took the liberty of searching CHAMP software. I wanted to learn about that. So I already inserted that into the address, so that's why you're seeing this right here. So I'll just run the report on that since the address is ready to go. And then here's where you get to program eligibility. So it's not eligible for rural health clinic status, but interestingly, it is listed as shortage designation. So for primary care, dental care, and mental health. So that can be useful to see too. And it's considered a medically underserved area. This literally got added today. So I'm so excited I get to share it with you. But we have these different starting points. So sometimes if you're just like, I need to know, I'm an educator, I'm part of the media, I'm part of the healthcare workforce, I'm care about funding. You know, these are just examples of some of our stakeholders who look at this site. Where can you get started? Well, we just added the Rural Health Transformation Program starting point page. So if I click here, you'll see all the different places where we're cross-referenced. Again, you'll see this in different areas of our site, but we do have an RHTP tag, just like I showed you public health or maternal health, so you can see what's been collected so far in our online library. You can also see the state level RHTP information. So if I click here, I find this really interesting. Our policy expert worked really hard on this. You'll see every single state's rural health transformation program, the summary, and the link to their project narrative. So some of them are a little bit different, like a budget narrative, potential uses of funds, and so forth. So you can find every single state's RHTP application here.